My patient, lay on the ground with a crooked neck. Okay, good head. So I'm hovering, let's see what the skill is this one. I want to say this is in chapter 21. There's one skill, 5-7, and then the rest of them are in 21. Kind of cockeyed neck. And it says just a skill, it's really quick. We don't even have to practice it. But it's in there, I want to have all the boxes checked. So when we get ready, first of all, so you can see if I got my BSI. When we start head stabilization, that's what we call it. Once you start, you're on that until she is taped down to the backboard. We'll get till the end of 10 o'clock, right? So what that means is you come on scene and you see this and you go, oh my God, let me do this. No, I can't stabilize her head and then call for help and call in what I need. So I'm gonna stay away from that. Ma'am, can you just, don't move your head, don't shake.
Okay,
Tell me yes or no.
okay,
I see your neck is at an angle. Is it, are you hurt?
yes.
Okay. Can you do me a favor? Can you squeeze my fingers?
I don't feel anything.
Okay. You don't feel anything in your hands?
No.
All right. How about in your feet?
Nope, I'm jacked.
Okay. Awesome. Make it easy on me. So then I'm going to call in. She's had compromised CMS in her hands and her feet. This is going to be an ALS call, right? But let's say she does have. See, most backboards, one of the reasons we're getting rid of them, they're precautionary. And it might seem like this is the biggest, most emergent thing we do. It's not. So take a minute, take a breath. Okay, it's probably one of the more elaborate things that we do, but it's not the biggest emergency. Whatever's happened has happened. What we want to make sure is that we don't shift something in transport that then causes paralysis. And what they're going to do instead of this, I don't really know, but right now it's backwards. So let's say that it's not all that.
Okay.
Can you squeeze my hands?
Mm-hmm.
Okay, good. And then, you feel that?
Yeah.
And then I check. Come down here. Can you feel me tapping?
No.
Yes, you can.
You said not all of it, okay.
No.
Yes,
just-
okay.
Okay, now push on. Pull up. All right, great. Okay, so then that's always what we do. I'm gonna do a manual head alignment, which is just what it says. Okay, and she's kind of crooked, so I'm gonna just kind of get her this way and this way, all right? Forehead, nose, chin, all the way down. That's what I'm looking for, and now I'm here. So this is gonna be the second or third person on scene. Now, put it like this, and say, ow, ow, ow.
Oh my God, ow.
Okay, all right, that's where it stays. And now, instead of a C-collar and a headbed, we're probably orchestrating something with a blanket. We do like a horseshoe thing, right, where we can just wrap it around there, or a pillow. We can do a number of things. It just kind of, once she gets on the backboard, we will pad it in place and tape it all down. And we would also do the roll this way. I've never had a patient present this way, but when we get to doing the roll, the person on the head is going to try to maintain this position that she's happy with. All that makes sense? So first part, we're not going to have any of that, okay? There's always going to be, yes, I can do this, boom. And then, so go ahead and stand up. C-collars, this is the second skill on this. We measure them, this was always confusing for me. So what we are trying to measure, 1, 2, 3, 4 fingers, your fingers parallel to the floor. So when I'm coming in, I'm not trying to do this number, everybody's gonna be a 4 or 5. I'm looking for her collarbone, well, not collarbone, go here, right here.
The trap.
Thank you. And then her, right here. So don't have your head up, look straight down. And then I'm going to, yep, there you go. I got 2 of them. So first thing we're gonna try to do is get an idea for how many fingers is her neck. So right here is gonna go more or less right there, because that's where the C-collar is, and then you can see I got 3 fingers. For some reason, there we go. Okay, it's resting there, and then I got 3 fingers. My fingers are parallel to the ground. Does that make sense?
Are you
Okay,
starting measuring down from like her jawline or measuring up from the trap?
so let me show you this. Okay. What I was doing was putting my knuckle kind of on her jaw, and then seeing how many fingers it takes to get to her trap.
Okay.
That's how I do it.
So you want to
Like Barba, before we get to sizing, Barba is going to be more like a 2. Okay, so it's right here, and if you can see, right? If you're looking from the side, you can see this, and you can see this.
Yeah.
Here, do it this way.
Over here. So boom, see 2. All right. So that's the first part, and then on this one, they have diagrams. These are the ones that we have on the hill, and you're gonna all get a chance. They have diagrams, and essentially what they're saying is this part of plastic, that's your bottom. That's the part that's gonna sit right there, right? And then the hole, in Deb's case, it's 3 fingers go to what they call a regular. Okay? So then you punch these up. The red is on regular, you snap it in, you snap it in. This should fit for Deb. This one, these pop out. It has a line meant to indicate where her chin is, the bone right here. And then it goes up, and then the other part is gonna be the plastic again, where it's gonna sit on her trap. So if I'm gonna go 3 on this, I'm putting my fingers on the line, and I got 3, I'm gonna snap it in. This one's got micro adjustments, that's got 4 sizes.
That's 16.
Josh told me this has 16. And you can see 3 fingers between the line and the plastic. Okay? So you're gonna get a chance to play with all these. Kind of like taking vitals. It's gonna take a little bit. Don't be afraid, don't be ashamed to ask for help. Okay? All right, now, the last part of it, I'm gonna have you lay down again, and Josh is gonna help me. Can you put your sweatshirt on? Does that have a hood too?
Oh, yeah.
Amazing. All right. I see people from other classes who just struggle with this, but nobody in our class struggles because they get it right. Because this is what I want you to do. I want you to hold this thing, bend it, I want you to grip it, like this, okay? I got the chin. This is what I'm doing. I'm coming right in, and I'm going, all right? So I grab a hold of this, I get an eyeball on her chin and her neck, go down on the ground. Somebody is holding stabilization, and I am going to, just locked in, it is. I'm going to just start, first of all, Josh is gonna, somebody's stabilizing the head, and I am maintaining this on a straight line. I'm not coming from over here and working it around, I'm not coming from over here. This is going just like this, okay? And then Josh is gonna start. Wait, did we decide you're a 2 or a 3?
3.
3? Okay. That's a little bit big. So. Okay, like these. Okay, so I'm coming in straight like this, and I never deviate off the line. Okay, and now Josh is gonna work it underneath. And again, somebody's holding her head. In fact, Carolyn, are you able to stabilize her head? Because we need this part. She's gonna lift the head a little bit. Okay, lift the head a little bit. And we're gonna feed this under. And we're gonna work all the clothing out. Josh, you got it?
No.
Carpet and Velcro.
Doesn't work. Got it.
Okay. And I'm gonna just keep feeding it in here. Keeping it dead center. And you gotta work, and then you're gonna see that Carolyn's gotta work her fingers out once we get it. You gotta pull this through. It's quite loose. There's nothing on this side. Yeah. And see while okay, so he just pulled it through, and I maintained it in its position. Now strap it down. Okay. All right. Any finagling with the helm, the hood.
Leave it in there. I want to show them something.
Okay. You can take a moment to do it, because I'm not deviating. I'm keeping this center point on her chin, and I'm not letting it move. That's my primary focus. And we're just going to keep working it in until it's in place. Josh.
So, everybody take a look. There's this little dot on the, on the bottom of the thing that should go straight down the middle. Why would you want to keep the neck visible? Anybody want to take a wild guess?